We now have Dr. Kay Redfield Jamison joining us to talk about her new book, An Unquiet Mind.
Hello, thank you so much for having me. It's a privilege to be talking with you.
So let's get right into it then. What exactly is your book about?
Well, it's the story of my life and just living with manic depressive disorder. In my story, I share my highs, lows, and everything before, during, and after. Where it started and how it has gotten me to where I am now.
So let's start at the beginning then. How was your first experience of your disorder?
Scary. I had no clue what was happening, but I guess looking back on it, it was exciting. At that point, all I experienced were the highs of my disorder, and not the lows, so for a while I was constantly happy. My marks were up, all my work came across as easy. There was no task that I could not handle. Life was great, everything was going my way. But after a while, I noticed my mood fluctuated a bit more. But even still, I was more happy than not. I did notice, however, that when I was down, I felt lower than I ever had, and I couldn't explain it.
And you didn't think much of it back then?
No. At first, the mood swings and stress accumulated from school, family, and life itself. There was never really any intense worry about my health at that point. Stress was something not only myself, but my friends and siblings have all been through. So it seemed to me like a perfectly normal response.
Perfectly normal response. And so, obviously you never sought out any help from anyone?
No, not at all. It was not until later on when the illness developed and the severity of it made me come to the realization that I was ready to seek help and reach out for medical assistance.
Now, when you stated you have never reached out for assistance, does that mean your family and friends were not aware of what was occurring to you?
Well, yes. Regrettably, I never had the courage to speak to anybody about my condition until later on in its development. For myself, it was not easy to express what was occurring in my head. I cannot imagine anyone would understand what's happening in my mind without experiencing the same thing I was, because then I really would sound crazy.
Now, did you ever feel like you were isolated from society or any types of loneliness as a result of your illness intensifying?
Initially, I did not. I've had a few friends in high school that also suffered from depression, and together we all seemed to fit as a whole and help each other out. After high school, however, it was more difficult. I had no one to talk to and I was really alone. Again, I was not interested in educating my depression to people. This included friends and family, and so it was an interesting path that I took on my own.
So now, after high school and after the initial stages of your depression, how did you continue to move on with your life? It couldn't have been easy with this depression weighing you down.
Well, after high school, I attended the University of California in Los Angeles. There, I found myself enjoying my studies, yet the intensity of my highs and lows began. I started to make large, meaningless purchases. For example, I once, for unknown reasons, felt the need to buy 20 books at one time. I don't even think I read them all, but for some strange reason, I bought the first 20 that I saw. When I was on my ups or my highs, all my work was simple, but I was spending more money than I was making at the time. But on the other hand, when I was on a low, I was inefficient, antisocial, and just felt like the world was too complicated for me to live in. My mind was constantly scattered all over the place.
And so, during these lower times, could you classify yourself as empty in a sense?
Precisely. I found myself losing concentration, like staring off into space a lot of the time, just letting my mind wander into absolutely nothing. I felt an overwhelming sense of inadequacy, and I began to consider dropping out of UCLA.
Wow. So obviously you hadn't dropped out, but I mean, how did you get through all that? You were still alone. You still hadn't told anyone of your condition?
No, I hadn't. I wanted to, but anytime I came close to walking into the campus medical clinic, I turned and walked away. I was too ashamed at the time. I think I was also really scared. I did not know what to expect, and I'm not sure I wanted to know. But going back on to how I got through everything, I was going through extreme mood fluctuations. I will admit my grades fell, and I did begin to fail classes. But I think what continued to keep me in the loop and not flunk out was my success of my papers and the positive feedback they received from professors.
And sorry, correct me if I'm wrong here, but at the time you were studying psychology, were you not?
I was, yes. It was uncannily ironic that what I was studying had to do with the mind, and just how I was literally studying myself and my own madness, although not the specific disorder I had, so yes, it was funny.
So now, let's just go back a little, just because I'm curious as to why you decided to go into psychology.
Well, mainly because of personal experiences, not so much my own as my father's. He was always a happy, joyful man, but I noticed as he grew older that he began to turn more bitter and aggravated. I missed the man my father was, and did not enjoy he had become. So it was safe to say that my interests were not so involved in myself as they were with my father, especially since by the time I figured out what I had was an illness and not just stress, I was long into my post-secondary studies.
Very interesting. And so now, let's talk about after your schooling. How has the illness affected you?
Well, as you know, I am now a doctor and professor at Johns Hopkins Medical School. So in the end, everything did work out for the best. The disease itself proved to be difficult to overcome. Basically, while at UCLA, a professor who shared not the same mental illness, but an illness nonetheless, asked for me to be his assistant. We shared time together discussing our thoughts on our own and other mental stigmas. He helped me to get my life back together, and he was the one to eventually make me realize I can go and visit a real psychiatrist. After that, it was months and months of me struggling with my medicine. The doctor prescribed me to go on lithium.
Why lithium? What does it do, and how does it help?
Lithium is a prescribed drug that, in the most basic sense, balances out sodium levels in the body. This causes the user to have a balanced mood, no expressive highs or lows. However, since lithium reduces moods, there also becomes less joy in activities people should enjoy. But going back to what I was saying before, I was put on lithium and over the course of several months went through a cycle of taking the lithium, thinking I would be okay without it, realizing I was not, and then continuing to take it again.
And this cycle continued on until...
Basically until I had asked my psychiatrist for his notes on me over the months of the cycles. I read through some of his reports and realized I need this medicine if I want to get over this illness.
And so, you got back on the right track. What did you do after you learned to balance yourself?
I decided to study more into my own illness. I teamed up with some other doctors with similar interests, and we began researching and tracking characteristics of the illness. What it does, how it begins, things like that.
And from what I understand, manic depressive disorder is something that cannot be cured. Is that correct?
Unfortunately, it is. We have searched for years trying to find a permanent cure, but have come up with nothing. The only thing that seems to work is the lithium, but that is a drug that requires the patient to take for their lifetime.
It must be exhausting, spending so much time and not finding any results.
You have no idea the work our doctors put into the extensive research. Our patients willing to go through countless MRIs, CT scans, and just doing what they can to help us. The chemicals, elements, drugs, just everything we have tried. The constant excitement and then the letdown. You almost feel like you're going through the depression again.
And now that we're on to the scientifics of the disease, how is one diagnosed? How do you get the illness?
Well, this is research we have completed. We've known that there's a direct link in manic depressive illness in families, so unfortunately it is genetic. Going back a few minutes ago, this explains why both my father and I give everyone so much hassle. He passed it on to me. Fortunately, it does not transfer through all offspring, and this is why my sister and my brother are normal. Through some more research, we've also discovered that both men and women are equally likely to have manic depressive disorder. This is very interesting because in a basic depression, there tend to be 2 times as many women that are affected than men.
Wow, really interesting studies. So now, as we come to a close here, would you mind just telling us what you do now, how you feel about your illness presently?
Sure. Well, now, like I said, I'm a professor and psychiatric doctor at Johns Hopkins. As the professor of psychiatry, I teach about mental disorders and help in trying to diagnose illnesses. I still research illnesses. However, I feel that it is more important to teach others about them, to allow for more minds to find cures, to research, and to just explore the mind. My own mental illness is behind me. As I said before, it cannot be cured, but I've decided that I will not let it weigh me down. Sure, it will always live within me, but with the right amount of lithium and the determination to overcome the illness, to be the best human being I can be, I'm happy with the successes I've achieved in my life.
Well, we'd like to thank you for coming out and speaking with us. We wish you the best of luck in your continued research and teachings.
Thank you so much for having me. It was a pleasure to be able to discuss my life and findings with you.